Good morning. Thank you for joining us today for this media availability. My name is Marie Moe. I serve as the Chief Communications Officer at the North Dakota Department of Health. We are pleased to welcome you today. In just a moment, I am going to publish here to this meeting the statement that we put out this morning regarding the announcement of the FDA approval for certain individuals to receive a booster vaccine for COVID-19. This information was also sent out via our Media Core listserv and is available on our website. Today, we do have several of subject matter experts with us today. The purpose of this media availability is to answer questions for the media partners who may have things that they want to ask related to boosters, to provide clarification about what this guidance means so that you can shape your stories and your communication as you reach out and provide that service to the citizens of North Dakota. I do have the Q&A open. I ask that if you submit a question that you please identify the media organization that you are affiliated with. I'm still learning who everyone is, and I look forward to having you here today. To get us started, we don't have a real formal agenda here today, so I'm just going to ask that Molly Howell maybe give us a brief overview, and then we are just going to jump right into taking questions. So Molly, without any further ado, I welcome you to give a few comments, and then we'll move on to questions. Thank you.
Sure, thanks, Marie. So late yesterday, the CDC recommendations for booster doses were finalized, and that's based on the FDA authorization for booster doses of the Pfizer vaccine that occurred earlier this week. And so people who are recommended to receive a booster dose include people 65 years of age and older and residents of long-term care facilities. They should receive a booster dose of the Pfizer COVID-19 vaccine at least 6 months after completing their initial Pfizer series. The other group that's recommended to receive booster doses are people ages 50 to 64 with underlying medical conditions that put them at high risk for severe COVID. They should also receive a Pfizer booster dose 6 months after they completed the Pfizer vaccine series. The next two groups I'm going to recommend may choose to receive a booster dose based on their individual benefits and risk. So that includes people 18 to 49 who have underlying medical conditions that may put them at increased risk for COVID, and people 18 to 64 who are at increased risk for COVID-19 exposure and transmission based on their occupational or institutional setting. All of these recommendations only apply to people who initially received the Pfizer COVID-19 vaccine, and only those who initially received that Pfizer series can receive a booster dose. It's likely in the future that there may be recommendations for people who received Moderna or the Johnson & Johnson vaccine to receive booster doses, but they just need more data and more science in order to make that determination. I do want to reiterate that although we will have booster doses now available, but these COVID-19 vaccines that we have available in the United States are still very effective. You are 5 times less likely to have COVID-19 if you are vaccinated, and you are 10 to 22 times less likely to be hospitalized for COVID-19 if you've been vaccinated. And so these vaccines are still highly effective, but we are starting to see waning immunity against infection, meaning having symptoms of COVID-19. And then for our 65 and older population, we're starting to see waning immunity against hospitalization, hence the recommendation for people 65 and older to receive a booster dose. I also wanted to mention that it may not be possible for people who want a booster dose to go out today to get one right away. Healthcare providers are also just receiving this information, and they have to educate their staff and update their protocols in order to provide booster doses. And so it may be next week or later next week when the general public can access booster doses. I think that's all I wanted to provide today. We do have additional staff on who are subject matter experts that can answer questions. Dr. Paul Carson is here with me from the North Dakota State University Center for Immunization Research and Education. And then from the Department of Health, Tim Wiedrich is available. He's the section chief of Health Resources and Response Section. And then we have two COVID-19 epidemiologists, Michelle Dethloff and Abby Folson, who can also answer questions about COVID-19.
Thank you, Molly. At this time, I'd like to invite the members of the media to go ahead and submit some questions. We'd be happy to answer those for you today. We don't have any questions yet, so I'm going to salt the water a little bit. Molly, can you answer one of the questions that we get often about what does it mean to be fully vaccinated? And does that definition change with this recommendation for boosters?
That was addressed this week at the Advisory Committee on Immunization Practices meeting, and no, the definition for fully vaccinated does not change with the booster dose recommendation. People who have had 2 doses of the Pfizer or Moderna vaccine or 1 dose of the Johnson & Johnson vaccine are considered fully vaccinated 2 weeks after they complete their vaccination. And so although booster doses are recommended for certain individuals to be fully vaccinated, it's still just the 2 doses of the mRNA vaccine or the 1 dose of the Johnson & Johnson vaccine.
Thank you, Molly. I think that's really helpful information to have clarified. You mentioned that the booster vaccines are only for those who received Pfizer. So for those who received Moderna or Johnson & Johnson, I wonder, Dr. Carson, if you could talk a little bit about how people who have had their full dose of vaccine from one of the others, how is their vaccine standing up against Delta? And should they be worried that they can't get this booster dose, or is being vaccinated with any of these vaccines a good decision? And just maybe talk to us a little bit about Delta and vaccine in general.
Sure. So looking at the data that was presented yesterday at the Advisory Committee for Immunization Practice at the CDC, I think the story was really mostly quite good. They did discuss, as Molly just said, declining efficacy against infections and symptoms, but very strong protection still against hospitalization and death. And that's been persistent, and that's pretty much across the board for all the vaccines, maybe a little bit less for the Johnson & Johnson vaccine. And that hasn't really declined with time or with the Delta variant substantially. So I think people can be pretty reassured still that the reason for all the kind of changes in debate was because the data looked very good against what we care most about, that's hospitalization and death. The other thing that's come out, somewhat reviewed at that meeting, was that Moderna seems to be performing a little bit better than Pfizer, and Pfizer and Moderna together a little bit better than Johnson & Johnson. And I do think we're going to see recommendations coming out in the near future about boosters following those vaccines. But for the most part, people who have received 2 vaccines still, by and large, have very good protection against hospitalization and death.
Thank you, Dr. Carson. I know myself, having received Johnson & Johnson, it's good to hear these stories coming out that these vaccines really are effective, and that we don't need to be concerned about not being able to get a booster. And so I think that goes to what Molly was mentioning here about boosters shouldn't be perceived as making the rest of the vaccine ineffective. And so it's important to hear those words. So thank you for that. We do have a question from Amy Sisk at the Bismarck Tribune. She asked if we have any information on the occupations that are eligible for a booster. Is this just frontline workers like hospital workers, etc., or does this apply to a broader category of essential workers?
I can take that one or try to take that one. So we don't yet have official CDC guidance on who will be included in the occupational setting recommendation. It will likely include all essential workers, and it's up to the individual to determine based on their own risk-benefit analysis whether or not they should be vaccinated. But it definitely does include healthcare workers, but it could include, you know, people who work in correctional settings or people who work in group homes or even potentially teachers as well. And so it's really based on how at risk you are for getting COVID-19 at your workplace or spreading COVID-19 to vulnerable individuals in your workplace. And so I'm anticipating CDC will provide further clarification on that, but yes, it likely applies to all essential workers. I should also probably mention that both for the recommendations for people with underlying health conditions and for the occupation recommendation, those are all self-reported. And so people, when you're going to be vaccinated, you don't have to provide any sort of proof of an underlying health condition or proof of employment in order to receive a booster dose of COVID-19 vaccine.
Thank you, Molly. I think that this next question is about long-term care, and it's from Michelle Griffith as the forum. And perhaps, you know, as part of this, you might be able to talk about how we've been working with long-term care to prepare for this announcement. But Michelle asks, will there be a prioritization for those who are in long-term care, those who are 65 and older and 50 to 64-year-olds with underlying conditions? Oh, this sounds like Michelle, like you pulled off the statement and asked it back to me as a question. That's a long question. So will there be prioritization of boosters for those that are eligible? And basically, is there a priority for vaccinating the CDC's recommendation for those who should and those who may? So will there be a priority put in place?
So the number one priority for COVID vaccination in North Dakota is getting people who have not yet been vaccinated against COVID-19. That is going to make the biggest positive impact on this pandemic, is getting those who haven't yet been vaccinated. If you look at our hospitalization data, the vast majority of people who are hospitalized in North Dakota and stressing our capacity have not been fully vaccinated. And so that is the number one priority for vaccination. In terms of the booster dose recommendations, there isn't a hierarchy for prioritization of booster doses. We're being told by the federal government that there's more than enough supply of Pfizer vaccine to support these booster doses. And so there isn't a prioritization. However, we have worked closely with long-term cares across the state. We surveyed all long-term cares and have established a primary and backup vaccinator for each long-term care. And we've put a challenge out there to the long-term cares and their vaccinators to try and get long-term care residents vaccinated within a couple of weeks after CDC provides booster dose guidance. And so we do really want to get those individuals vaccinated, but it will take a few weeks to do so. But really, again, the priority is vaccinating people who have not yet been vaccinated.
Thank you, Molly. I think that's important to talk about those who haven't been vaccinated. I personally know people who have put off being vaccinated and they're thinking, well, if I get sick, I'm going to go and just get that monoclonal antibody treatment. And so I know we have Tim here with us today, and it might be good just to talk about, Tim, what should people know about putting off this vaccine for monoclonal antibody treatment? And I know your team has been coordinating the distribution of monoclonal antibody treatment across the state. So maybe you could just share a couple words about that. Tim, you're on mute. Pesky technology.
Sorry about that. There's no question that monoclonal antibodies is an effective treatment regarding COVID, but we now have increasing demand and an inadequate supply across the country for providing monoclonal antibodies. And so on September 13th, the U.S. Department of Health and Human Services announced an immediate change to how it's being distributed. States are now being allocated a prescribed amount, and that's based on the amount of product that was previously being used. And so we have a substantial reduction in the amount of monoclonal antibodies that's available to us. And that supply is not meeting the demand that we have within North Dakota. And so we completely anticipate the fact that we're going to run out of monoclonal antibody. That supply is continuing to remain very constant. We're in our second week coming up next week of the allocation. And so it's really, really important that people not rely on monoclonal antibody as a mechanism for treatment when in fact vaccination is a way to prevent having the illness to begin with. I can't emphasize that enough. I don't know when products going to be restored back to the earlier levels of availability because demand is shot up across the entire country. So we're going to be on this allocation process for a while. And again, monoclonal antibody is not going to be universally available.
Thank you, Tim. I think that's really important messaging when we talk about the importance of being vaccinated and, you know, choosing about what you're going to do here. I know, Dr. Carson, we shared out some information that you provided earlier this week about people are either really choosing, they're choosing which risk they want to take, the risk of the vaccine or the risk of getting COVID. And I think one of our questions here from Doug B at KNOX, he's asking, what do the latest models show for COVID-19 in North Dakota? I'm not sure who wants to tackle that and answer that question. Oh, Dr. Carson is pointing to who? I can't see.
I think Abby or one of our epidemiologists or Michelle would probably be best able to handle that.
The technology screens don't show me who's pointing at who. So Michelle or Abby, does someone want to take that on?
Hi, can you guys hear me? This is Michelle.
Yes, thanks, Michelle.
Yeah, so I can take that on. As far as cases and what we're seeing surveillance wise, we've been holding steady around, I'm just gonna say an average about like 650 cases a day, 120 hospitalizations, that we've had like active hospitalizations, not new admits a day. And so where we're gonna go from here, I mean, we don't know if we're gonna increase. I mean, during our peak, we had over 2,000 cases mid-November per day. So there are some southern states and some other states in the United States that with Delta, we're seeing more cases than they did in the previous wave. So we don't know where we're going to go from here, but we haven't seen decreases. Like I said, we're holding steady. But there's still a significant activity out there, and we have to think about testing as well. You know, these are the people that go in and get tested and get reported to us. You know, we know that is not perfect, so we know there are more infections out there. You know, testing has increased recently with this recent surge that we have seen, but we do know that we are likely missing some cases. So it is important to take, you know, our prevention and, you know, vaccine and the other measures that public health have talked about. So we really don't know where it's going, but we've been holding steady at a significant number of cases.
Thank you, Michelle. I think that's very helpful. Okay, so I think we have one more question here, and just want to let you all know that we are going to wrap it up in a couple of minutes. So if you have anything else that you were hoping, please go ahead and get that submitted now. What it looks like might be one of our final questions here is from Michelle Griffith at the forum. She asks if we can clarify when boosters will begin to be administered in the state, particularly which locations or counties, and what instructions we are giving healthcare workers who are administering the boosters.
Yeah, so booster doses will likely start being administered next week. There may be some providers that are able to start administering this weekend, but probably the vast majority later next week. And that's just because they have to update their protocols. Providers have very specific protocols for how to administer vaccines, and usually a physician has to sign off on those protocols. So they'll need to update that information based on the recommendation that happened late last night. Booster doses will be available widely across the state. We have over 420 providers who have enrolled to administer COVID-19 vaccine in North Dakota, and these include local public health, pharmacies, private clinics. We also have the North Dakota Department of Health has a nursing team that goes out and offers pop-up clinics across the state, and those will also offer booster doses later on. And so really anyone across the state should be able to have access to boosters if they're wishing to be vaccinated. Also, I know a lot of employee health, like at the health systems and hospitals, will also be vaccinating their staff. In terms of instructions that we're giving to healthcare workers for administering the booster, so far we've just sent out the recommendations, as that's the only information that we have available. But the Centers for Disease Control and Prevention will be providing trainings to healthcare workers on the booster dose recommendations. And they'll also provide sample standing orders and then materials that healthcare providers can offer to their patients regarding the booster doses. And so all of that, a lot of it will be happening next week, or even possibly later today. We'll get some additional information to healthcare providers.
Thank you, Molly. And I want to thank everyone for making time this morning to join us for this media availability. We really appreciate our partners at the media in helping get these important messages out to the citizens of North Dakota. That will be our last question for this morning. And I will be sharing, just as I did in the beginning of this chat where I posted the link to the statement, I will include here in a moment the titles and the names of people who spoke in the presentation today. So you have that as a resource as you put together the materials that you need for your for the stories that you prepare. If there's anything else that we can provide for you, please don't hesitate to contact me. I'll put my information in the chat as well. We appreciate your time, and we hope that you have a great Friday and stay healthy.